This is Part G, capillary exchange, and Part H, integration of cardiovascular function. It would be a good idea to have completed the previous parts of this unit before continuing. Part G, capillary exchange, describes the movement of material into and out of the blood. We need to review osmosis just a bit. Capillary exchange is also referred to as fluid shift because fluids are shifting, is the movement of material into and out of the blood through the capillaries. Capillary exchange involves osmosis. Here's a quick review. Let's take a membrane, a selectively permeable membrane, and let's separate two solutions. On the left side, the solution has a higher water concentration compared to the solution on the right, which means the left side has a lower solute concentration compared to the right. The osmotic pressure on the left side is less compared to the right because osmotic pressure is proportional to solute concentration. The side with the lower osmotic pressure is hypotonic. The side with the greater osmotic pressure is hypertonic. Now, the same principles also apply to other solutions. For example, a solution may be composed of other types of diffusible particles. This would be a penetrating solute. If, for example, on the left side, there's a high concentration of diffusible particles compared to the right, and a low concentration of non-diffusible particles compared to the right. The osmotic pressure on the left would still be lower compared to the right, and the left side would be hypotonic. So we can compare solutions by what diffuses across the membrane and what does not. We will emphasize the diffusion of water through the membrane. Notice the net movement of the diffusible particles is from its high to its low concentration, or from low solute to high solute. Now that can be a little confusing, so I will review osmosis periodically. Let's look at capillary exchange. Let's see how it works. Now, it can be kind of complicated because there are 4 specific forces involved. We measure the forces in millimeters of mercury. For example, there's blood hydrostatic pressure. It's a force of pressure in the outward direction. That's just a fancy name for blood pressure. There is interstitial osmotic pressure. That's the osmotic pressure of the interstitial fluid, the surrounding fluid. It's a low pressure. There's interstitial hydrostatic pressure. That's a physical pressure of the fluid surrounding the capillaries. It's actually a negative pressure. And then there's blood osmotic pressure. It's a pressure forcing material into the capillary. Yes, it looks a little complex, but we can look at it in a little different way by simplifying these 4 factors. Before we do that, though, we need to understand that there are other factors affecting fluid shift. For example, the permeability of the capillary membrane, the presence of lymph capillaries to absorb excess fluids. The flow of excess fluids might be blocked in the lymph through blockage of lymph nodes, through removal of lymph nodes. As I mentioned, the forces can be condensed into 2 forces, which will help to explain what goes on. The osmotic pressure of the blood forces fluids into the capillaries. Now, don't let me confuse you with this. The number is shown on the outside of the capillary with the arrow pointing inward, but it's the osmotic pressure within the blood. Blood pressure in the blood forces fluids out of the capillaries. So you see, we have these 2 opposing forces. Filtration is the movement out of the capillary, Reabsorption is the movement into the capillary. What is the filtration pressure at the arterial end? Well, 35 minus 25 is 10. What's the reabsorption pressure at the venous end? Again, it's 10. 15 from 25. Since blood pressure exceeds osmotic pressure at the arterial end, the net fluid movement is out of the capillaries, that is, filtration. Since blood pressure is less than the osmotic pressure at the venous end, the net fluid movement is into the capillaries, reabsorption. Notice that as the blood flows through the capillary, the pressure drops 35 to 25 to 15. But the osmotic pressure remains relatively stable as the blood flows through the capillary. Filtration is usually slightly greater than reabsorption, which is not shown in the figure. It's roughly 0.3 of a millimeter mercury greater. The difference is the net filtration pressure. Excess fluid is absorbed into the lymph capillaries by the lymphatic drainage system, as we mentioned a moment ago. The lymphatic drainage system can drain fluid at 15 times greater than the normal filtration rate, so it has a large safety factor. If net filtration pressure rises to roughly 4.5 millimeters of mercury, the lymphatics fail to drain the excess fluids. Specialized capillaries exist in the body. The capillaries of the lungs have a low blood pressure. Pulmonary blood pressure is around 7 millimeters of mercury. The net reabsorption pressure is 8 millimeters, and so very little filtration of fluids occurs in the lungs. On the other hand, the capillaries of the liver, they are very permeable, so permeable that proteins can easily enter the blood and exit the blood. On the other hand, capillaries of the brain are very impermeable. They form the so-called blood-brain barrier that prevents harmful substances from entering the brain. Edema is an abnormal increase in interstitial fluid. Pitting edema is a depression left in the skin when pressed. Hydrothorax is an increase in fluid in the thorax. Abdominal ascites is increased fluid in the abdomen. Causes of edema include excess filtration. This might be due to increased capillary blood pressure. We'll describe it shortly. It might be due to decreased plasma protein concentration. We'll also describe this. It may be due to increased capillary permeability, allowing fluids to leak out. Decreased lymphatic drainage may be due to damage to lymph nodes by malignancies or by radiation, as we mentioned. Surgical removal of lymph nodes may also damage the lymphatic drainage. Obstruction of the lymph nodes can have the same effect, decreasing lymphatic drainage. What might cause increased capillary blood pressure? One cause would be a local increase due to venous compression. If the veins are compressed, the blood pressure builds up in the capillaries, leading to those veins. A general increase may be due to congestive heart failure. The pressure increases behind the heart, that is, the blood leading to the heart. If the failure occurs in the left ventricle, this would lead to pulmonary edema. It's due to increased pressure in the lungs. Right ventricular failure, on the other hand, would lead to systemic edema in the body due to increased pressure. We'll give some examples. For example, what if we increase blood pressure by 5? Now, before we go on with that, please note that I'm using hypothetical figures. The actual change would be much less than this. If you do increase blood pressure by 5, the filtration pressure would be, now notice at the arterial end, the pressure is 40, 25 from 40, 40 from 25 is 15, the filtration pressure. Reabsorption pressure, on the other hand, would be 5. Blood pressure has decreased to 20, and 20 from 25 is 5. What about the net? Well, subtract the 5 from the 15, and we get a net filtration pressure of 10 millimeters of mercury. Decreased plasma protein concentration could be caused by severe liver disease. Remember, the liver makes many different proteins. Malnutrition and starvation results in decreased protein intake. It can result in abdominal ascites. Renal disease causing increased protein loss can affect the plasma protein concentration. For example, if we decrease the osmotic pressure by 5, the filtration pressure now becomes 15. Because the osmotic pressure is 20, the blood pressure is still 35. The reabsorption pressure now becomes 5 because the osmotic pressure again is 20. 15 from 20 is 5. What is the net? 10 filtration pressure. Increased capillary permeability may follow burns or allergic reactions. In second-degree burns, the epidermis is not destroyed, and capillary damage will be perhaps mild. Blisters may form. They're called blebs. In a third-degree burn, on the other hand, the epidermis is destroyed. Severe damage happens to the walls of the capillaries found in the dermis. Great loss of fluids occurs. Allergic and inflammatory reactions mediated by histamine and other such agents result in local regions of edema, including hives and wheals. It may lead to pulmonary edema and shock. Let's look at some examples of capillary fluid shift. To maintain homeostasis after increased water intake, hemorrhage, or abnormal states, starvation leading to abdominal ascites, standing leads to edema in the ankles because gravity may increase capillary pressure in the feet from 25 up to perhaps 105 millimeters of mercury. Congestive heart failure. Here's a table that we'll complete. We'll look at water intake, an increase in water intake. We'll look at hemorrhage and starvation. We'll look at what happens upon standing and the consequences of congestive heart failure. Let's take water intake. If water intake increases, the initial blood volume will increase. Oh, it may be ever so slight, but an increase in volume would increase systemic blood pressure. Therefore, capillary blood pressure increases, and the net fluid movement would be out of the capillaries. So the response would be a decrease in fluid volume in the blood. So you see, the system, the capillary exchange system, carefully monitors and regulates blood volume. What about bleeding, hemorrhage? Well, if hemorrhage results, this causes a decrease in the initial blood volume. Therefore, the systemic blood pressure decreases, capillary blood pressure decreases. Net fluid movement then is into the capillaries, and it restores the blood volume. So hemorrhage, as long as it's not too severe, can be corrected. What about starvation? In starvation, plasma proteins are decreased. Therefore, The colloidal osmotic pressure decreases. Let's skip the capillary blood pressure. Of course, that would be a decrease as well. But the net fluid movement would be out of the capillaries. And the result is an increase in tissue fluid volume, the ascites we've mentioned. You see pictures of starving children in Africa. Sometimes they have an enlarged abdomen, and you might wonder, how in the world are they starving if they look so full? Well, it's not nutrients, but water that's been lost from the circulation. Standing. When you stand, the volume of blood in the legs increases. The venous pressure will increase, and capillary pressure thereby increases. This results in a net fluid movement out of the capillaries, which increases the fluid volume in the tissues of the leg. Swollen ankles, for example. Congestive heart failure. In congestive heart failure, the venous volume increases because, as we mentioned, the heart is not able to move the blood beyond, so it builds up in the vessels supplying the heart. Venous pressure increases, capillary blood pressure increases, and the net fluid movement is out of the capillaries. The result is an increase in fluid buildup in the parts of the body affected. We mentioned pulmonary edema and systemic edema. Well, finally, let's look at Part H, the last section of the cardiovascular function. I call it the integration of cardiovascular function. The purpose is to maintain cardiovascular homeostasis. In some ways, this is a review of things we've talked about already. Cardiovascular homeostasis is maintained by capillary fluid shift. Well, we've just covered that, so we don't need to cover it again. Reflex control of blood pressure. This requires baroreceptors to monitor blood pressure. Baroreceptors are pressure detectors. A barometer, for example, detects air pressure. The baroreceptors monitor the blood pressure, and they're located in strategic locations, like in the carotid sinuses. That's where the common carotid arteries branch into the internal and external carotids. It's found at the angle of the jaw. The aortic arch baroreceptor, located strategically to monitor the pressure of the blood flowing upward toward the brain. If the initial change is an increase in blood pressure, what's the response change? Now remember, we're talking about homeostasis. So if the initial change is an increase, the response change reverses that. It would be a decrease. In reflex control of blood pressure, let's say there's an initial increase in blood pressure. The baroreceptor activity is thereby increased, and impulse frequency within neurons of the vagus nerve to the cardiovascular center is increased. The vagus nerve supplies the cardioinhibitory center, which then increases its output by way of the vagus nerve. Now remember, this is called vagal tone. The cardioinhibitory center acts on the accelerator center to turn down its activity, so its sympathetic output is decreased. The vasomotor center, meanwhile, receives input also from the baroreceptors, and this would decrease vasomotor center activity and thereby decrease sympathetic output. Now remember, the sympathetic output is called vasomotor tone. The heart rate then will decrease and arterial diameter will increase. The effect of all of these is to decrease blood pressure back to normal. The baroreceptors function in rapid response. In long-term blood pressure changes, the baroreceptors adapt to a new pressure level. Hypotension, decreased blood pressure, may result from hemorrhage, standing, shock. Standing is kind of interesting. You may notice that when you're squatted down looking at an object near the floor and you stand up quickly, you feel momentarily dizzy. Well, almost immediately, your reflex response is to restore blood pressure back to normal. Let's look at shock. Shock is failure of the cardiovascular system to provide adequate blood to vital organs such as the heart, the brain, the lungs, and the liver, the kidneys as well. Emotional shock acts on higher centers in the brain to decrease blood pressure. It may cause fainting if the brain does not get enough blood. It can become positive feedback when the lack of blood decreases the functioning of the cardiovascular center. This results when feedback response fails to correct the initial decrease in blood pressure. Types of shock include hypovolemic shock due to hemorrhage, cardiogenic shock due to decreased cardiac output. Usually this is due to left ventricular failure from a heart attack, myocardial infarction. Vascular shock is due to widespread dilation of the vessels. Anaphylactic shock is due to allergic reaction. Septic shock is due to toxic reactions, often caused by bacterial infection of the blood. Let's look at muscular exercise. Muscular exercise turns out to be one of the most stressful conditions faced by the cardiovascular system. There are three major effects of exercise on the system. Mass discharge of sympathetic nervous system activity throughout the body. Remember that the general role of the sympathetic system is to constrict blood vessels. Increased cardiac output. Largely, this is due to an increased venous return. Remember the so-called skeletal muscle pump. Increased arterial blood pressure. Increased exercise is associated with an increase in blood pressure, which should reflexively decrease blood pressure, as we just described. But in this case, higher brain centers override the reflex control. The active muscles are the muscles involved in the exercise. I'll use body referring to everything else. Does blood pressure rise during exercise? When exercise increases, the sympathetic activity increases. What does this do to body vasoconstriction? It causes an increase in the vasoconstriction. When exercise increases, what does this do to the active muscle vasodilation? Now note, we're talking about two opposite occurrences. It increases the dilation of the muscle of the vessels in the active muscles. When exercise increases, what happens to cardiac output? Well, we know that cardiac output is increased. We'll see the mechanism, we'll review it actually in a moment. Body vasoconstriction alone would do what to blood pressure if it was the only factor of the three? Well, it would increase blood pressure. Active muscle vasodilation by itself would do what to blood pressure? It would decrease blood pressure. Cardiac output alone would do what to blood pressure? It would increase blood pressure. Notice the two factors increase blood pressure and one factor decreases blood pressure. To reinforce this discussion, here's a hypothetical situation. Let's assume two elderly gentlemen are doing some physical activity. One gentleman is on a ladder, hanging the picture on a wall, and his wife is directing the placement of the picture. The other gentleman is digging a hole in the yard to set a post. which gentleman might have a greater risk of heart attack or stroke due to high blood pressure? It would be the one hanging the picture. You might have thought, just intuitively, that the one outside, here he is digging a hole, probably perspiring, using a lot of muscles. But no, it's the one hanging the picture. Why is that? Well, it's because he's using fewer muscles, so the active muscle vasodilation effect to lower blood pressure is less. The gentleman digging the hole is using many muscles, so the active muscle vasodilation effect of lowering blood pressure is greater. Let's look at this in a little more detail. If the sympathetic nervous system raises blood pressure by increased cardiac output and causing vasoconstriction, how does exercise dilate the vessels in the active muscles? Local control does this. It leads to vasodilation in the active muscles, and this alone will decrease blood pressure. How does it work? Well, remember, the active muscles use up oxygen, they generate carbon dioxide, they secrete signal molecules, all of which dilate the vessels that are supplying those muscles. And so it increases their blood supply, their nutrient supply, and their oxygen supply. Using fewer active muscles results in less of a decrease in blood pressure. Using many active muscles, as in vigorous exercise, results in a greater blood pressure decrease. The active muscle vasodilation and increased skeletal muscle pump leads to increased venous return, which increases cardiac output. This is the most important cause of the increased cardiac output in exercise. Let's look at increased sympathetic activity. Sympathetic nervous system constricts arterioles, blood vessels. That would increase arterial pressure, thereby decreasing blood ejected from the ventricles. This leads to an increase in end systolic volume, which increases the end diastolic volume. The increased activity of the skeletal muscle pump constricts veins, increases venous pressure, increases blood flow into the ventricles, and also ends up increasing the end diastolic volume. This then increases ventricular stretch and force of contraction. Thereby, the stroke volume is increased and cardiac output is increased. And that's a look at Unit 19, the physiology of the cardiovascular system. You're now ready to go on to Unit 20, the respiratory system.